Welcome and thank you for joining us for our 7:30 news bulletin. My name is Tandiwe Nzumara. First, the headlines. Pope Leo XIV calls for greater care for workers and workplace safety. High Court in Lilongwe adjourns Chimwendo Banda bail hearing to December 24th. Advocacy groups vow legal action over Constituency Development Fund Amendment Bill if the President assents to it. And in our exclusive report this week, Bridget Manoga and Charity Shilanga explore how a wash intervention has transformed maternal care for expectant mothers at Ntondo Healthcare Center in Nchisi District. We do have the details of these stories and more. Just stay with us. In an address to Italian employment consultants on Thursday, 18th of December, Pope Leo XIV encouraged them to be close to those who need most help, such as families with children or employees who take care of elderly or sick relatives, and to continue promoting safety in the workplace. He met with the Italian Order of Employment Consultants at the Vatican in light of the 60th anniversary of the establishment of the Association of Employment Consultants Professional Register. In Italy, employment consultants offer companies advice and support in matters related to employment, hiring, labor laws, and social security. We have more details in this Vatican News report read by Phyllis Chizombe.
Citing words from his predecessors, Pope Francis and St. John Paul II, Pope Leo explained that the center of any work dynamic, there should be neither capital nor market laws nor profit, but rather the individual, the family, and the well-being, to which everything else is secondary. The Pope insisted that employment consultants should help meet the needs of young families, parents with small children, or those who, despite their jobs, have to take care of elderly or sick relatives. Pope Leo also encouraged employment consultants to continue in their important work of promoting workplace safety in order to prevent accidents. Italian employment consultants are in charge of offering and learning information and training courses for employees on this topic. He quoted Pope Francis, who in a speech in 2023 said that safety at work is like the air we breathe. We realize its importance only when it is tragically lacking, and it is always too late. Lastly, Pope Leo emphasized that employment consultants have an important mediation role in terms of facilitating relationships between management and employees. He pointed out that employment consultants manage legal and administrative aspects that are fundamental to the lives of workers and their families, and so there could be two temptations. Quoting Pope Francis' apostolic exhortation, Evangelii Gaudium, he added that both are harmful because in the long run they make the company environment unlivable, preventing it from being according to its truest vocation and supportive synergy. Pope Leo that invited the employment consultants to not do their work weighed down by the employer's perspective, but to pay close attention to the people in front of you, especially those who are in difficulty and have fewer opportunities to express their needs and assert their interests.
High Court Judge Mzondi Mvula has adjourned to Wednesday, 4th of December 2025, the hearing of a bail application by Richard Chimwendo Banda, Secretary General of the Malawi Congress Party, MCP. Chimwendo Banda applied for bail pending trial, but the state, through Senior State Advocate Lukia Jafali, opposed the application, arguing that there was no urgency and requesting at least 2 weeks to prepare a response. However, his lawyer, that is Chimwendo Banda's lawyer, Jefferson Gadzipatige, submitted that the matter required urgent consideration, telling the court that his client is traumatized and remains under police guard while receiving medical treatment. In his ruling, Judge Mvula ordered the state to file a written response by Monday, December 22nd, and scheduled the bail hearing for Wednesday, December 24th at 10 o'clock in the morning. Chimondo Banda will meanwhile remain admitted in hospital under police guard pending the court's determination on the bail application. Here is part of what the defense lawyer Kanzipatike had to say.
Scheduled for hearing today at 11 a.m. But the judge was busy today, and as you might have seen, so we started hearing the matter at 1 p.m. This afternoon. So before we started presenting our application, the state had their preliminary application. They applied that they would want the matter adjourned because they have not filed their response. We objected to the application. However, the judge has directed that the matter should be adjourned and it will be heard on Wednesday next week at 10 a.m.
Mm-hmm. Maybe, are you satisfied with what transpired?
Civil society organizations, CSOs, and the National Advocacy Platform, NAP, have warned that they will challenge the recently passed Constituency Deal and Fan CDF Constitution Amendment Bill in court if President Professor Arthur Peter Mutharika assents to it. The groups argue that the bill is unconstitutional and risks politicizing development at constituency level. Speaking after the civil society grouping submitted a petition urging President Mutharika not to assent to the bill recently passed by Parliament, NAB Chairperson Benedicto Rondoe noted that the bill contradicts a court ruling which barred members of Parliament from directly managing CDF resources. Gift Kalonga has more details in this report.
Rondoe expressed concern that assenting to the bill would undermine the original purpose of CDF, which was meant to bring development closer to the communities without political interference. He said the petition invokes Section 75 of the Constitution, which empowers the President to refer a bill back to Parliament if it is deemed not to be in the best interest of Malawians. Kondowe warned that the amendment risks turning the CDF into a political tool, thereby undermining its original objective. He noted that President Mutharika had previously increased CDF allocations to 5 billion kwacha to promote grassroots development without requiring citizens to constantly seek assistance from Member of Parliament.
The immediate challenge is that it will bring the CDF into the whims of politics. It can be abused politically. It could not serve the intention, the good intention that the President, Professor Arthur Peter Mutharika, had aligned, where he said he wants development to be closer to the people. He doesn't want people to be always going to Capitol Hill to look for development. That development framework is why the APM decided to increase CDF to 5 billion. So we believe that this is a significant investment which can turn around development in the areas. And if we maintain with the law as it is, chances are high that development will continue to be politicized.
The petition has been signed by 12 civil society organizations, including NAP, MAGA, CSAT, NACA, MEGIN, CCJP, Nyika Institute, YAS, among others. For Luntha News, this is Gift Kalonga.
The Competition and Fair Trading Commission, CFTC, has urged Malawians to remain vigilant during the festive season by advising consumers and warning traders against violating consumer rights. In a press release, CFTC has advised consumers to always demand receipts, check expiry dates of products, seek redress when necessary, and verify the credibility of online shopping platforms. We have more details on this report by Patrick Popper.
According to CFTC spokesperson Innocent Helema, The Christmas season is characterized by increased commercial activities and spending, which are often accompanied by widespread violations of human rights. Helema therefore urged consumers to be alert and assert their rights throughout the festive period.
The Competition and Fair Trading Commission wishes to advise consumers to be vigilant and assert their rights during this festive season. CFTC is also warning all traders against engaging in unfair trading practices with the intention of exploiting consumers.
CFTC has also reminded traders of their obligations under the Competition and Fair Trading Act, warning that non-compliance will attract stiff penalties.
You're still watching news coming to you live from Bishop Nephi Media Center, and today with me, Tandu and Zumara. Before we proceed, let's have another look at the headlines. Pope Leo XIV calls for greater care for workers and workplace safety. High Court in Lilongwe adjourns Chimwendo Banda bail hearing to December 24th. Advocacy groups vow legal action over Constituency Development Fund Amendment Bill if the President assents to it. And in our exclusive report this week, Bridget Manoga and Charity Shiranga explore how a WASH intervention has transformed maternal care for expectant mothers at Ntondo Healthcare Center in Nchisi District. Proceeding with the news, the Malawi Airlines has reaffirmed its commitment to supporting the government of Malawi in boosting the country's economy through expanded air connectivity. Malawi Airlines Chief Executive Officer Solomon Bekele Dibey made the remarks during the return of the airline's inaugural flight on the newly launched direct route from Kamuzu International Airport in Lilongwe, Malawi, to Entebbe International Airport in Uganda. We have more details on this report found by Emmanuel Chiwocha.
In his remarks, Dibey described the inaugural flight as a significant achievement, not only for the airline, but also for Malawi as a nation. He said the routes demonstrate Malawi Airlines' commitment to national development beyond commercial interest. Dibey noted that successful launch reflect growing confidence in Malawi Airline among customers and key stakeholders. He said the overwhelming support received since the announcement of the route has been encouraging and confirms the strong market demands for improved regional connectivity. He added that the direct Lilongwe-Entebbe route has already shown positive results, particularly among business travelers, tourists, and government officials seeking convenient and reliable travel options. Dibey emphasized that beyond business growth for the airline, the new route will play a crucial role in boosting tourism, agriculture, and trade. He said improved airlink will facilitate the movement of goods, services, and people, thereby strengthening economic ties between Malawi and Uganda.
People were very excited, very happy to see Malawi Airlines starting this flight, and we have seen promising prospects in terms of number of passengers in the future. We had a chance also to meet some authorities and the community leaders, in which they also emphasized the importance of the flight and how they are going to use.
The new route was officially launched on Monday, December 15, making a major milestone in Malawi's airline regional expansion strategy. The direct flight is expected to improve travel, efficiency, and enhance economic cooperation between the two countries. For Luntha News, in Lilongwe, this is Emmanuel Georgia.
For years, expectant mothers seeking maternity services at Ntondo Health Center in Nchisi District faced a harsh and risky reality delivering babies in a facility without reliable running water. The absence of this basic necessity not only compromised hygiene standards but also put the lives of mothers and newborns at constant risk. Women arriving in labor were often accompanied by guardians who carried an additional burden. With no water on site, guardians had to walk long distances to nearby streams or boreholes to fetch water for cleaning, bathing newborns, and supporting basic care during delivery. One such woman is Rebecca Bedulo from Saninga village, who vividly recalls her first delivery at Ntondo Health Center. There was no running water and her guardian had to walk far from the facility in search of water, leaving her anxious and vulnerable during labor. Her experience mirrors the struggle faced by many women in Chisi district, where the lack of basic water services has long compromised maternal health care. In this week's exclusive report, Bridget Manoga and Charity Chilanga explore how expectant mothers at Ntondo Health Center once faced unsafe conditions and how a wash intervention has transformed maternal care.
When Rebecca Petulo went into labor for the first time at Ntondo Health Center several years ago, she expected care and safety. Instead, she was met with a maternity ward without running water, forcing her guardian to walk long distances to fetch water during her delivery. In a maternity unit that handles an average of 30 deliveries every month, this situation often compromised hygiene and delayed care at critical moments. Today, Rebecca's story reflects remarkable change. She recently delivered her second child at Ntondo Health Center, this time with running water available throughout the maternity ward, thanks to Water Aid's wash intervention. Ntondo Health Center is a public primary health facility serving over 5,400 people from at least 68 surrounding villages. The facility provides general outpatient services, maternal and child health care, and other essential services. However, its remote location and limited infrastructure have long affected service delivery, particularly in the maternity wing. Through the 150 Healthcare Facility Challenge, Water Aid is committed to improving wash services in health facilities across Malawi, including in Chisi district. Working closely with the district council and the district health office, the organization prioritized Ntondo Health Center due to its high patient load and urgent wash needs. Senior Nursing Officer, Infection Prevention Specialist for Chisi District, Lest Longani, says the intervention has significantly improved infection prevention and quality of care.
At first, we had a very good water supply system. Then, fortunately, a year ago, one of the pipes got damaged and it was supposed to be replaced. And as of now, the whole district and also the DHO is aware of it, and we're working so hard to rectify the problem, and we hope that we're going to fix that as soon as possible.
At the center of this transformation are the health care workers who provide care daily. Felicia Mtega, a nurse, midwife, technician, and maternity in charge at Ntondo Health Center, says the availability of running water has transformed how services are delivered. She said before, providing care was extremely challenging. Sometimes one of them had to leave the ward to look for water, even when a mother was in labor. But now with the reliable water on site, they can focus fully on assisting mothers safely. The clinician in charge at Ntondo Health Center, Ephraim Nyilenda, agrees, noting that the intervention has restored confidence among both staff and patients. He said the support has come at the right time as it has strengthened infection prevention and control and improved overall services.
The maternity audit has improved such that when pregnant mother delivers, they access water simply.
Water Aid Programs Officer Laston Zungu says the Ntondo intervention reflects the organization's broader national goal of ensuring that no health facility operates without basic wash services. Through the 150 Healthcare Facility Challenge, they are working hand in hand with government and partners to ensure safe water, sanitation and hygiene in healthcare facilities.
So the issue at hand was that at the time, the water system that was in place, it was small, based on capacity, looking at the catchment population or the number of people who get the services from the health center, and the water system which was there at the time, and looking at the other necessary facilities, they were just not adequate. So at what end, we upgraded the system by providing a bigger and more powerful water pump.
For women like Rebecca Petulo, the changes at Ntondo Health Center go beyond infrastructure. They represent dignity, safety, and renewed trust in the health system. In 2021, Water Aid transformed Ntondo Health Center by providing it with running water. As Water Aid continues to strengthen health services through targeted partnerships, Ntondo Health Center now stands as a powerful example of how WASH interventions can save lives and transform maternal health care.
That report also brings us to the end of what we had for you in this edition of our news bulletin. But before we go, here's a reminder of the headlines. Pope Leo XIV calls for greater care for workers and workplace safety. High Court in Lilongwe adjourns Chimwendo Banda bail hearing to December 24th. Advocacy groups vow legal action over Constituency Development Fund Amendment Bill if the President assents to it. And in our exclusive report this week, Bridget Manoga and Charity Shilanga explore how a WASH intervention has transformed maternal care for expectant mothers at Ntondo Healthcare Center in Nchisi District. My name is Tandy Wenzumara. Thank you so much for keeping me company, and to continue following the rest of our programs right here on Luntha TV. Just a reminder that you can also catch us on social media. We are on Facebook at Luntha Television and on YouTube at Luntha TV Official. Continue following the rest of our programs and have a lovely, lovely weekend.